Hi everyone, welcome back to my channel. My name is Stephanie, and if you're new here, I'm an internal medicine doctor and I make videos on health, wellness, and my life as a doctor. So hit that subscribe button to follow along, as well as click that bell so you never miss a video. We are living in a time where paranoia is on the rise and sensibility to others is down. And I get it, this coronavirus has been around for several months now and it's probably not going away anytime soon. I was in clinic the other day and I had a patient who was very distraught about a situation that occurred while she was out in the community. She was at the grocery store where she suddenly had an attack of coughing and sneezing related to her known seasonal allergies and asthma. While she was there, she was getting awful looks from everyone around her. People were avoiding her, people were whispering around her, and the looks of disdain were enough to make anyone cry. She was constantly apologizing and letting them know that she has seasonal allergies, she has asthma, she does not have the coronavirus. But eventually she felt so uncomfortable that she left the store. So this made me feel really sad because I have lots of patients who have asthma and allergies and may be experiencing similar symptoms to this patient, where they are so afraid that their symptoms may go out of control while they're out in public, that they may be shunned by everyone around them. Today I want to talk to you about other things that cause cough, sneezing, and wheezing, such as allergies, as well as differentiate between allergies and the coronavirus. What are allergies? There are different types of allergies, such as seasonal allergies that usually have to do with the environment. There may be allergies that you have all year long, such as an allergy to animal hair or food allergies, as well as other medication allergies. I'm going to talk about seasonal allergies as they are the main allergy that is occurring around this time of the year. When you have an allergen, there's a specific particle, such as grass or pollen from trees, or sometimes mold and other things in the environment, that can actually cause your immune system to overreact to that specific allergen. So when the body takes up that allergen, there's actually a response from cells called basophils or mast cells where they take in this particle, and then this causes a reaction where they produce a chemical called histamine that's released and causes an inflammatory response. And when you have this inflammatory response, you usually get the symptoms of allergies. So some of the main symptoms of seasonal allergies include nasal congestion, sneezing, itchiness such as itchiness in the nose or eyes, as well as even itchiness around the throat. You can sometimes feel fatigue due to the fact that you haven't slept well at night from these symptoms that have gone on during the night. Or you may have even that tickle in your throat that could produce a cough if you have associated asthma or a postnasal drip. Now this may differ from the symptoms of the coronavirus, which we know include fever as the number one symptom that most people have been experiencing. There may be an associated cough with this, shortness of breath, headache can be also associated with the coronavirus, overall muscle and body aches, severe fatigue, sometimes a loss of smell, and you may even have GI symptoms such as diarrhea. So the main differentiating symptoms between seasonal allergies and the coronavirus are, the first would be fever. You really will never have a fever when you have seasonal allergies. It's not associated with it. So if you do have a fever, that would be more of an alarm symptom of an underlying infection, and that's when you may consider the virus. Things like shortness of breath. Someone who has regular seasonal allergies may feel a bit short of breath, especially if they have associated asthma, but it really shouldn't affect them that much. Unless they're having a full-blown anaphylactic reaction, which again is not always associated with pollen allergies, then they really shouldn't have that much difficulty with their breathing. Therefore, shortness of breath, I would say, is still more associated with the coronavirus or another type of viral respiratory infection. Another symptom that's very interesting is the loss of smell. So they've actually found that with the coronavirus, it may affect the olfactory nerve, which is a nerve that allows you to smell things. But most of all, this is not affected in allergies. Although you may be congested and have a runny nose, you really haven't lost your sense of smell, it just may be a little more difficulty when you're all stuffed up. Another important symptom would be this body ache type feeling. When you have seasonal allergies, you don't really get body aches or soreness in your muscles. It's just not really associated with this. that would be a symptom that would be more in keeping with a viral illness and could be the coronavirus. Finally, overall fatigue. You may have some fatigue with allergies, but it shouldn't really compare to the fatigue that you feel if you have a viral illness. Another important differentiation between the two is the timing of these symptoms. When you have seasonal allergies, they usually have to do with the time of year. A lot of people may experience symptoms in the springtime, so around March to June, where they have very significant allergy to pollen from trees. They may also have summertime allergies where they actually are allergic to the grass in the summer. And then some people experience more allergies in the fall, where they have them between the months of September and October. When you think about the timing of coronavirus, usually you've been in contact with someone who has it, and the timing may be between 2 and 14 days before you actually start exhibiting symptoms. If you're someone who's never had any symptoms of allergies, it would be uncommon to suddenly develop them, but it can occur. Now, is there a test for seasonal allergies? And the answer is yes, of course there is. There's usually a test for most things. The test that you would do for allergies is a skin test, and it's actually called a skin prick test, where they take an area on your forearm, they mark off different areas so that they know exactly which allergen that they're testing for, and they prick you with a little device that uses a bit of allergen just to get below the layer of the skin. It doesn't break any skin, it's not painful at all. I actually had my own allergy test once when I was a resident. I was doing an allergy and immunology rotation, and it was a bit of a slow day, so they asked me if I wanted to get my own allergy test done, and honestly, I had never had a test like this done before. So I marked up my arm, and I'll show you guys a photo out because I actually took a photo at that time. And when you do seasonal type allergies, you do a test for things like pollen from trees or dust and mites, mold, as well as they even test for certain animal furs such as cats, dogs, and horses. After you've done the skin prick, you want to see if there is a release of histamine in that area that had the prick. You look for redness as well as a bump on the skin to form, and this bump may look similar to hives, when you have little bumps that occur on your skin that are actually quite itchy. So I did this test on myself, and I waited a few minutes, and I noticed increasing itchiness as well as a large bump that formed around cats, dogs, and horses. And the funny thing is that I've had a cat for 18 years. And I had a feeling over those 18 years that I was allergic to cats because occasionally I would get symptoms of itchiness, itchy eyes, runny nose, but honestly, he was my childhood pet, so I didn't really do much about it. So that's the main test that you would do for allergy testing. Finally, moving on to treatment. When you have allergy type symptoms, there are a few treatments that you can do initially to start off before even seeing a doctor. The first would be to try over-the-counter medications such as antihistamines. So things like Reactin or Claritin or Allegra are type of medications that can help reduce the histamine response and then may help decrease the amount of itchiness or nasal congestion that you're experiencing. Other types of symptoms can include things like nasal sprays, which you may need a prescription for, or saline solutions where you actually help clean out if you have really bad nasal congestion, so you can use a nasal spray for that. Finally, if you are experiencing worsening seasonal allergies or things that kind of are more prolonged that go throughout the entire summer, then you may be a candidate for other types of medications such as leukotrienes or even allergy shots or immunotherapy that are done after being assessed by an allergist or an immunologist to see if you may benefit from that type of treatment. We are in a time where allergies and asthma are a normal occurrence and are very prevalent around this change in season, and that not every cough or upper respiratory symptom is related to the coronavirus. We need to be aware that our behavior of cautiousness can sometimes come off as rudeness or even discrimination for people who suffer from other medical conditions that may cause them to cough, such as asthma or chronic bronchitis. At the end of the day, we're going through this pandemic together, and as our communities begin to open, we need to be mindful that not everyone who has a cough or upper respiratory type symptom is related to the coronavirus, and that there are other medical conditions out there. Please comment below if you've experienced a situation like this, or if you have symptoms of asthma or allergies and are worried about displaying them out in public. Also like and share this video with someone else who may find it helpful. And finally, please subscribe to my channel. I really appreciate your support, and I hope that you've been able to learn something from these videos, as I enjoy making them so much for you guys. Everyone, stay healthy, be happy, we'll get through this pandemic together, and I'll see you on the next video.